Our biggest hurdle, honestly, is referrals. We put referrals in the computer to go out, and then, we assign it to someone on the front end to make sure that we get the demographics, the notes, and whatever else we might need for that referral. And then just, getting, I guess we're kind of spoiled because we like to bring up, such as we use the Lymphedema Health Center in Huntersville or Mooresville area. And we would like for their names to even show up into our note. But it doesn't without us typing it, because in the referral spot, there's no way of looking up anybody that's not within our, I guess, the circle of what's in the system. And then once you send that referral out and that doctor faxes that referral back, I call it on the MEMS side is that's kind of our closed loop, because that way you're faxing it out, you're going to receive it in, and then you can close out that note saying that it's complete. So when they fax it back, there's no way when they fax it back in the fax to connect it to that physical note. So we either have to print it, which I refuse to print, or we have to upload to our desktop and then attach it, upload it to the actual thing to do it. So I don't know if there's an easier way to do that, but I know, that's our hurdle. We spend a lot of time doing that.
I understand what you're saying, and the reason you're having trouble is you're not doing it the way ECW wants you to do it.
Okay.
There's no good reason to attach the referral to the encounter note where you made the referral. The referral note that comes back should be attached to the order for the referral, like the lab results are attached to the order for the lab.
But we either have to print those or we have to upload them to our desktop if they're faxed.
Because we get faxes in from pathology from Eastern Carolina that don't come through the pathology lab. They get faxed to us. They get attached to the order matched with the lab result, and it shows up in our DNL jelly beans. I'm wondering what I'm missing, either, or what you're missing. But Jen and Lisa, what would be different about faxes coming in to the faxes in ECW that can be attached to, like, a fungal nail order?
When you do that, there are instructions. In the instructions, there's a drop down that also says attached to referral note. No, and Paula, are you trying to do that or attach it to
a referral order?
Well, when the fax is sitting there and you are clicking on that fax, you have that fax. So I don't know how you attach it to anything except as to add to patient. So you would add to patient, you go to their date of birth, and then the next thing you get is what folder you want it to go in. And then you get what documents you want to name it as. And then your next, let's see, I'm just trying to go by it through my head. I think the next screen is if you hit, you have to hit review. If you don't hit review, then it stays in your box, and then it pops up the next screen, and then it says you either review document, or something else. So maybe it's in that screen that you attached something, and maybe that's where we're missing it.
So I've pulled up the instructions in the email. I can't really. So I pulled up instructions in the email. It says, if you received this fax in your fax inbox DCW, select the down arrow in your fax inbox. So I'm looking at but I'm looking at this document, and I click the down arrow, and there is a lot of choices. One says attached to labs. So I hit attach to labs. I search and find the patient.
Mine did say attached to labs.
Do you have that little, mine, it's really, really tiny button that's a down arrow. So from reading from right to left in the list of faxes, and I'm in web mode, I have a button that says delete document, add to patient, send to staff, and then I have a down arrow with a whole bunch of options. Create telephone encounter, delete, attach page to patient, attach to patient, attach page to docs, blah, 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 blah. Attach to referral notes, attach to consult notes.
So you go to your fax inbox and you do your web mode?
I used web mode, yeah. So under my D Jelly Bean Fax Inbox web mode. But if you
Yeah.
see my screen, right above my cursor here is this tiny little arrow.
Uh-huh.
And if I click it, I get this list.
We were using the fax inbox and I don't see that. So
I
the only
cannot.
thing that we have.
I find it very hard to believe that this functionality, even if it's not done this way, I find it hard to believe that you don't have this ability somewhere in plug-in mode. Web mode is usually the quote unquote redheaded stepchild of ECW. So I would
love to speak to that.
Dr. You can go into the fax in mode, the fax, because so I am in my fax inbox plug-in mode now, and I do not have that little drop down.
Do you have a fax in there?
And I do have a fax.
Okay.
Thought I had them all cleared out, but I do have a fax. The only thing that I have, you have to pull up your facility. You have a department, a sender fax. I have a printer, a trash can, and a refresh. And then at the very bottom, I have add to patient, add page to patient, one-to-one, and close.
Paula, if you select the fax and then right-click on it, all of those items that Dr. Hodos was showing you on the screen, as far as attached to right there, but yes, you can do the same. One of the nice things about this, Dr. Hodos, because you can't see my screen, is that when you do open it up in plug-in mode, it is bigger, right? You can see that document in a much longer format, but if you right-click on the actual fax itself, you can, all of those are there, all of those same options.
Yeah, so that was easy enough. See?
Yeah, you ever find yourself printing things, Paula? You need to email me. We have the same aversion to printing.
Loved it on her Go Live.
Yeah, I did not like to print.
No, me neither. All right, cool. So you should be able to follow those instructions that came in that email, except the first thing that says select the down arrow, you're going to replace that with right click on the fax.
Okay, awesome. Okay.
And you should be able to do the same with referrals, the same with MRIs, CT scans, that kind of stuff too.
Yeah, that's what we've been doing. So this is awesome. Thank you. Okay, all right. Before we go, then let me ask another question because, so I'm in web mode because I really do like the layout where you can see what you have and then you can see your things on the side. But I was showing that I had a few faxes, but when I'm on that, I show I have nothing. Do you know what I need to click on to get my faxes to show there?
Yes. You have to, there's a button that says Facility Inbox Folder towards the top. You have to click that button. Okay. Go search for your facility.
Okay. Awesome. Thank you.
I guess my facility is already selected. Excellent.
You know how when you put in, I guess in CareCloud, it had so many possibilities. Like you could search for benchmark therapy or physical therapy. You could pull out these people, facilities that you might want to refer to, but I don't see that in our system. It looks like the only thing that we can pull in is the facilities that has been you guys have put in there, or it is only physicians.
So
and we
that
find
was,
ourselves at a lot of physicians.
you know, that was one of the things you said earlier, that, you know, you always use this one place and you have a hard time referring or sending to them. If I am going to send to physical therapy, let's say I'm going to do a referral to physical therapy, my common physical therapy locations are in here under provider. For example, this is the orthopedic physical therapy. These guys are the ones I use all the time. And it puts them in,
Right.
it puts in that it's physical therapist. Are you unable to do that?
We are I was just using this with the new place that we had started. It was Lymphedema
Right.
Health Center. And it's not in there, so we would have to add it.
Yes. We've had to add this. We had to add this one. We had to add
Okay.
all of our referring doctors, because when we got it, there's nothing. So you should be able to add that just like you add referring doctors, and do
Okay.
this way instead of having to do anything. And then I believe that everything from, you know, that's entered about that patient, or excuse me, about that place, I think is printed on the referral.
The note. Yes,
Here it
and the
is,
referral.
physical
Yes.
therapist. Yeah, here it is. So the address, the phone number, everything would be on there for you or for the patient or for whoever.
Okay. So we
So let's
just
make
need
sure
to add it.
you just need to
Okay.
add it. Yeah, but isn't that, Lisa or Jen? Isn't that the same way you add referring doctors and things, which I'm sure, Paula, you've been doing, right? So
We
it should be
have
no different than that.
okay.
That's correct.
Is that right? Okay, great.
Okay.
Yeah, so you just add that
Okay.
one and then it'll be there for you. You know, hey Lisa, when we started with ECW, we asked if they would add in this list of people a podorthist, right? Because we have a podorthist that comes to the office, and they never
Mhm.
have. Would you ask them again, somebody, to do that? I'm just thought of it because what I do is I refer to podiatry and then refer to, you know, just our office for our podorthist. But I'd like to have it say podorthist and have his name and everything in there, if that would be possible. So we just need to add that
Okay.
category of podorthist, or specialty rather. Another one would be good is UVW, is wound care. Wound care center would be good too.
Oh yeah.
Okay.
Cool. That's great.
I think that's probably the only other thing, which I know that I've been in touch with Jen and Lisa this week, is that, you know, I know my front end forgets to do the date of last seen, and a lot of times that is really, it's really not a front end. In our office, it's really not a front end position. It's really a back end, because when they're back there, during their evaluation, they're trying to determine, you know, when their date of last was with the physician and what, you know, that kind of thing, whether it was, endocrinologist, or was it a PCP, or who it was with, so that we can make sure that we get that information in our notes to be able to send the notes back out to them if that's what needs to be. So a lot of times the front end will miss that data last seen. So there's nowhere on the back end to put that date of last seen. So then it has to go back up to our front to put that in, and then sometimes that doesn't happen, and then it's still not in, and then I start to do the note, and then that's, then I try to catch it, but I may miss it too. So is there somewhere on the back end that and when you're doing your note, that you might put that in?
Not that I know of. Because
Okay.
before ECW, our office, that job was for the back office as well. That was our assistants that did that. So I think the reason we moved it to the front is because the place where that information needs to be put in is best accessed by somebody in the front much easier because it's part of the screens and workflow they have and not built into the screens and workflow that we have in the back. At least that's what my memory is telling me, and somebody will correct me if I'm wrong, but I'm pretty sure that's why it moved, because we were always in the back to do that too. We have found that our answer is, hey, please don't forget to put the date last seen in. Hey, please don't forget that. That's our workaround there. That's how we do that.
So yeah, it's yeah.
Yeah, we also, as much as I do hate paper, we print at least one piece of paper for every patient, and it's a buck slip, right? We don't put the diagnoses and charges on there, but the things they purchased and when I want them to come back maybe, or some notes, please, add 10 minutes for the next visit, or whatever. And on there, we have always had it written the month and date. Yeah, so you could have that be part of it, that they need to put it there. That way, when that chart goes back, if it's not there, the people up front say, don't bring that patient back, and that can be a check before they get back. But no, I don't think there's a good place. I don't think there's a good place in the back workflow for that, that I know of.
Okay. The only other thing, I guess, is, when you have a little pop-up, like we had in CareCloud, we had a little pop-up note set for people, that maybe this person needs to make sure they pay their balance, or this patient, and I'm just going to say has hepatitis or something like that. I know that's not something that you're supposed to put in their record or whatever, but we kind of did that as a pop-up just for us to be on the alert side, not that we changed anything. But there's not really a good place that you actually have a pop-up from the front end to the back. So, and the reason I'm saying that is because on my front end might not necessarily see my office visit notes. They're only on the front end. So we've been putting it all into our billing alerts, which in reality should not go there.
But
so
they don't pop up, do they?
Yeah, the billing alerts pop up.
Oh, great, because I had asked about a way to pop something up, and I really want to do that too. Because I was going to tell you that I just asked that a couple of weeks ago and didn't have a good way, but maybe. So the billing alert will pop up. Is that red lined window that also talks about meaningful use?
Yeah.
Oh,
Yeah.
I am so used to just making that go away. But yeah,
Right.
it's yeah.
Look at it because
No.
it tells us we didn't put in, their race or their non-intensity and things like that. So that's a good thing for us. We put things in there so we know to do it. So even I have been even using that, and it may not be a good place, and maybe you guys can tell us. I've been even putting it in there for our orthotic coverage and things like that in that spot, because when the back clicks on it, they can see it, and then the front also can see it when they click on that patient, when they open that patient up.
I did not even know of that way, so I do not know of another way.
Okay.
So yeah, I like that ability. Like, I want something to pop up that says, do not reappoint this patient when somebody opens the chart or does anything with it.
Right. So Dr. Hodos, if you look at your screen now, and you see you have your InStride TV, but then you have allergies and you have billing alerts. So if you click on that billing alert, you have that's that billing alert.
Allergies,
so
like these allergies here?
So up here at the top where you have your eClinical works, you have your picture and it says InStride TV and they're 54 years old.
Oh, I do.
Okay.
Billing alerts.
And then you have billing alerts. So if you click on that, that gives you your information.
Yes. Yes, and this is that same.
No, but if you click on that billing alert, but since you already have the patient open, you won't see it. So you see the billing alert when you open it. But that billing alert will always be right there if there's one alert there. So all you have to do is click on that, open it up.
Yeah.
But, I mean, I guess if
I guess it's the same kind of thing, right?
No, two different things. Billing alert is billing things that you need. Your global alert is when, let's say that you do a procedure like 10060, that you know that's a 10-day global.
Yeah.
So that global alert should pop up and tell you that you should do something. I've never got mine to work, so I'm not really sure. So I have to go out and count my days.
Yeah, CareCloud used to be really good at that. CareCloud would say that right there, global period until whatever. And I've seen those global alerts here for other patients that say like Tenotomy 28010, global alert, whatever. Those look like they were made by somebody. They didn't look automatic, but I would wish that it would be an automatic global alert when you build something with any kind of global period.
Right. So I've not been able to see that. So I don't know if I'm going to go out on a limb and say that they see that on the billing side. But when the doctors are doing the note, they need to know that they're still in that global, because especially if you're in that 90-day global for surgery, you can do a lot of things in 90 days and don't get paid. Or you might need that modifier. And so, like I said, I've not had mine to work. I've been counting days.
Me too.
And I have a spreadsheet that has my surgery people, and I can tell you how many days they're out.
Gotcha. Yeah, maybe it's attached to the code, right?
The ECW has the global alerts in the system is so that you can add any kind of information that you want to pop up on a patient.
Right. But why? But there must be some difference between the recommended use or the practical use of global alerts versus billing alerts versus insurance alerts, right? And I understand it may be your role at the company as to which ones pertain to you, but I know when I pull up a patient, this box is there with all of these. It's not like I only see the global or I only see the billing. I'm pretty sure I see them all. Although, like I've said, by now I can get rid of this window pretty quick. Could we use it for that, right? Because global alerts, when you make one, have an expiration date. So if you do, patient is in global and you put the expiration date for your 90 days, then I would bet when this comes up, right, it'll say that one was phone call, whatever, right? And it'll have an expiration date, and then it'll disappear. So you could probably use that right now. Just put patient is in global and put an expiration date, and then when this orange box pops up, the doctor can see still in the global or not in the global, right? It may also be nice to put in, the name is, post-op global, and the notes could be the procedure, right? So it's a little more specific or whatever, but you could probably use that now to do this. It'd be nice if it was built in to the codes, like you had said. So
So when you,
You know,
yeah,
the next time I just refresh this, but look, now that global alert is here, right? So if you put one in there that says, you know, patient in post-op until or whatever, then that's going to show up. Even if you ignore this, the orange box, it's gonna be there in this global alert. You can manually put it right there and have it expire after that 90 days. And then version 2 is every time I bill a 28296, make a post-op global alert for 90 days.
I'll have to do that too, because that would help a lot. Like I said, I'm keeping a little sheet to keep up, because maybe a patient comes back in and it's something totally different. Then I need to make sure that I put the correct modifiers on it.
Sure, that's right. That's right.
Yeah.
Right, because you may have, hey, this patient's in a global period for their bunion, but they came in for an ingrown nail. So now I need the 24 for the evaluation of the ingrown nail and the 79 for the procedure. And now I have one global alert that expires in 10 days, and the other one that is still, 47 days out
Right.
or whatever.
Right. Exactly. Exactly.
Guys, I'm also in a test patient on my side, and I don't know how this thing orders in what order, but I think I went to page 3, and there is a surgery global that you could then, just like you said, edit it, say that it expires on 3/31, and add in your notes. And then Dr. Hodos, can you do that and then refresh, and just so we can see how that works in a progress note?
I need you to start again, because I didn't understand where you were starting from. You threw me with page 3.
Yeah. If you go to the patient hub for your test patient, and then go to billing alert, and then there's that button just to the right of global alert where you can select a new one.
Yeah.
And if you hit next, I believe twice. I don't know why
I see.
this
Okay.
is. Yeah. See surgery global.
I do.
Then you can edit that with the pencil.
Appointment. This is an appointment and billing global alert. There are clinical global alerts and both. I don't know the differences there, but yes, I could put this here, and I could put and expire it tomorrow. And that's the same thing. We could have done that right from this button that you had showed me too, Paula. But now if we reload this, here. Right?
Yes, and it's right there. It tells you can literally key in whatever it is you want to know, or at least have it there on that right-hand side to reference.
Paula, I kind of count you as knowing what you're doing here, but you've had 3 questions and we've been able to answer them. I think we should stop.
We're on
I concur.
I was really ready to say I don't know to you quite a lot, but I feel pretty okay.
Dr. Hart is fun to show us up on these calls, so thank you for asking us questions.
No worries.
You're welcome.
That's great. All right, y'all. I certainly would answer anything else you have, Paula, but I'm very happy that you were here, and thank you for coming.